Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. And if you're watching this, you have some type of back, butt, and/or sciatica pain. Do you feel like a cat chasing its tail? Do you feel like you're constantly stuck in this problem-solving mode of jumping from doctor to doctor, specialist to specialist, provider to provider, trying to figure out the cause of your pain? If so, this video is for you. Stick around. I'm going to help you understand where you're currently focusing your treatment and why it's not working and where you might want to look instead. So real quick, for those of you who are new to the channel, welcome. My name is Dr. Charlie Johnson. I am a physical therapist. I teach people all around the world with back, butt, and sciatica problems how to resolve their pain naturally using the power of their mind and movement as medicine. And getting to the point of this video, I teach people how to treat the cause of their pain, not the effect, all right? And again, this is for you if you're stuck in trying to figure out mode, right? Of wondering, hey, well, what is my diagnosis? And wow, I was told this is the reason why I hurt, and this is the reason why I hurt. And before you know it, you've got lots of reasons why you hurt, but nothing's working. And here's why. So what if I were to tell you that you're treating the effect, not the cause? Meaning, this is really important, all right? Did your back, butt, or sciatica pain come first, and then your diagnosis, then your problem? Did your back start to hurt first, and then you were diagnosed with a herniated disc? Did your back or your pain, your back hurt and or your pain begin, and then you went to someone who told you get an x-ray or an MRI, and then they showed you what was wrong? If so, then are you treating the cause or the effect? All right, let me lay this out, all right? So, if you can agree that your pain came first before your diagnosis, or let's reverse this. Did your diagnosis come first, and then you started to feel pain? Now, maybe there are a couple instances where this might happen, but were you told, hey, you have spinal stenosis, and then your pain came? Were you told you have an unstable SI joint, and then your pain came? Were you told that you have piriformis syndrome, and then you started to experience pain? Probably not. You probably aren't going to get an MRI or showing up to a physical therapist saying, I don't hurt at all, give me a problem, give me a label. It's not the way it works in medicine, right? You start to experience your pain, and then you go and you look for a reason why to explain that pain. All right, so here's really what's happening. All right, so you have the cause. Hopefully you can read this. All right, cause, which is pain. And then the effect of that pain, the effect, is some diagnosis, right? It's a disc problem. It's spinal stenosis. It's your SI joint. It's piriformis syndrome. And the list could go on and on. And the treatments are focused on fixing the disc, the stenosis, the SI joint instability, the piriformis syndrome, don't just think diagnoses, think reasons why. Reasons why you've been told that you hurt. Maybe you have, that says leg length, a leg length discrepancy, and that's why you hurt. Maybe your pelvis is rotated, or you have this type of tilt, or that type of tilt. All right? And the old school thought is, hey, if I have a disc problem, then you do treatment A. If you have stenosis, you do treatment B. If you have an SI joint, you do treatment C. If you have piriformis syndrome, you do treatment D. If you have a leg length problem, you do treatment E, and so on and so forth. And you kind of get this alphabet soup type of treatment. Right? Now, we know that a lot of people have these problems, these diagnoses, and or reasons for why they might hurt, and feel no pain at all. There are lots of people walking around out there with uneven legs, and they don't hurt. There are lots of people walking around with one leg, and they don't hurt. There are lots of people walking around with disc problems, and they don't even know it. And so, if you're trying to figure out what is the cause of your pain, realize that by treating the effect, you're worsening the cause. By treating your diagnosis, the thing which probably already agree with me, came after you started to hurt. You weren't given a diagnosis and then you started to hurt. You started to experience pain. That was the cause of you, or the reason why you went to see someone who then, as a result of that pain, gave you some reason why you hurt or slapped a diagnostic label on you. And so, therefore, if you agree with that, you must also agree that you are treating the effect of what started this whole cascade of problem solving. The pain that you experience. And so pain is the cause. Your diagnosis and all that you're trying to figure out here and all the people you're going to see is the effect of that initial pain experience, because you want an answer as to why it hurts. But what's interesting is that, like a cat chasing its tail, you're the cat, your diagnosis is the tail. Your reason why you hurt is the tail. The more you try to treat the effect, the more the effect becomes the cause of further pain and suffering. The more you try to figure out the cause of your pain, the more you Google things, the more you go from one specialist to the next, and you get this label, a disc problem, a joint problem, a nerve problem, which then leads to a whole bunch of different treatments. Another rabbit hole. They all have their own little rabbit holes. You're now watching this. You've gone through a bunch of different rabbit holes. You've gone down a bunch of different paths. And you're probably watching this because you're not getting to where you want to be. And so you're looking outside of you to explain why you hurt, when the cause of why you hurt started within you, your pain experience, your brain and your body. Those are the two things which make it up. And so be careful not to allow the effect of this pain that you started to experience become the cause. Cut it off. The less you try to chase your diagnosis, the less you try to go down the rabbit hole of figuring out what the source of your symptoms are, the less fearful, the less worried, the less distracted you can become, the less noise there is within this problem, quote unquote, to be solved, the more clarity you gain. Are you treating the effect, or are you treating the cause? The more you treat the effect, the more you try to figure it out, the more you try to treat your diagnosis, the more pain and suffering you experience. The effect becomes and or fuels the cause. And like a cat chasing its tail, you become dizzier and dizzier and more confused and more frustrated until you surrender. You say, all right, maybe this doesn't matter as much as I thought it did. I'm telling you, it doesn't. All right? You don't have to believe me, but this is what I see happen every day. And so where we begin, and where I would recommend you begin, is that what started first? Were you given your diagnosis first and then you started to hurt? No, you started to experience pain. And that cause, or catalyst, we'll say, is what set you in the direction of all this stuff. So all this stuff, therefore, is the effect of this thing which you call pain. And so if you can agree that the cause is pain, then you're not treating the cause. You're treating your diagnosis, but the cause is over here. And your cause is the pain experience. What makes up the pain experience? Pain is an experience, physical and emotional, mind and or body and or mind. When you move and it hurts, when you bend over and you pick something up and it hurts, you start to become fearful or worried. More fearful and worried, the less you move, right? The more avoidant you become. Oh, I shouldn't do that, it's bad. The more you start to link movement with pain. Movement is bad. I should be fearful of movement. The less you move. The less you move, more fearful you become. The more fearful you become, the less you move. The less you move, the more fearful you become, the less confident you become. And it just spirals. All right? And so, control the controllables. Treat the cause, not the effect. Be careful of letting the effect become the cause. The effect can become the cause. As you chase your diagnosis, you get more inputs, you become more worried, you become more fearful, you move less because someone told you movement is bad, and that becomes the cause and the reason why you're more stressed out and you move less and you hurt more. Because pain is an experience. All right? Treat the cause, not the effect. Pain is the cause, not the other way around. And if you've been treating it as such, and you're going down all these different rabbit holes, realize that that can be the very thing which you think will solve your problem, but it'll actually be the thing which keeps you from healing, because that effect will fuel the cause or the pain that you're dealing with. All right, so hopefully this video was useful. Hopefully you got something out of it. Really easy solution to start, right? Start asking yourself, if Charlie's right about that, what does that mean? Well, it might mean that this might not matter as much as you think. It might mean that the more you try to solve this problem, the worse you're going to hurt. And if you can step back, zoom out, and you can see what's actually happening here, you can just cut that problem solving off. The less you try to problem solve, the less anxious you become, the less worried you become. People think it'll do the opposite, right? Well, the more I know, the more I figure this out, then I'll feel better. No, because unfortunately, back butt sciatica problems, they're just a big trap, because everybody has their own thoughts and their own opinions and whatever. And so fact check me, it's totally fine. All right, but at the end of the day, you actually get more confused, because there is no answer. Because the whole time, the answer is within you. Because knowingly or unknowingly, you created the pain that you experience, with either something you did with your body or something that happened insult-wise to the mind, psychologically. And so therefore, nothing outside of you can solve it for you, but rather, it's all within. All right, hopefully this was useful. Watch this a few times, because it even took me a few little renditions. I repeated myself a few times just to try to get it across in different ways. Was this useful? Let me know your thoughts below in the comments. And on the end screen here, if you're interested in learning a little bit more about kind of how we do this differently, how we solve these problems, and how we teach people all around the world with back, butt, and sciatica problems how to become their own best healers and actually treat the root cause of pain, all right, which is the experience that they've created or that you've created. Again, not your fault, but you've got yourself in this trap somehow, and we want to help you get out of it, versus looking outside of yourself and feeling like you need to be reliant upon other people to fix you. It's just absolutely not the case in my experience, of course. All right, so check out on the end screen a free workshop that we've created that walks you through a little bit of, again, how we think through these things, how we problem solve things, and how you can start to look at things in a different way so that you can get a different result. All right, again, this is Dr. Charlie. Appreciate you checking out this channel. Be sure to comment below and let me know your thoughts. Thanks.